You'll see many things that are coming back today, and I caution you again over and over and over to be careful in what you do and be cautious. Now, right with that, I would like to just say just this. Yesterday, I said we were really watching an issue that was brewing in the Eastern Panhandle. In Jefferson and Berkeley County, again, actually day before yesterday, we had numbers that I was reporting to you on yesterday. Today, I'm reporting to you on numbers of yesterday. Those numbers are not good. That's all there is to it. Berkeley and Jefferson County, I think, have 20 and 15 respectively numbers of positives yesterday. Now, the real truth is we tested a lot of people there. And we're trying to get to absolutely the bottom of exactly what the issue is. We know with the exposure to Virginia, with the exposure to D.C., right there at these counties, we have a gigantic population of people that can absolutely infect those people in those counties and cause a big-time problem there. So, what do? We do what I've told you we're going to do over and over and over. We're running to the fire. You're going to hear in just a few minutes that I've directed our National Guard to go within hours and report back to me first thing in the morning as to all their findings from the standpoint of their assistance with the health people there and any and everything that they can come up with. It may very well be that we have got to take more stringent, guidelines than what we have today there, and if we do, we'll do that tomorrow. Absolutely, without any question, you've got to understand that my first and foremost responsibility is to protect you. And that's what I'm going to do. And I take that job very seriously, and I've told you many times I'll do my job. Now, I would urge all those people, as I do West Virginians in general, but absolutely, especially in those counties, you have got to wear a mask when you go out and you're in a public building. You have got to wear a mask if you're at a store, wherever it may be. I would tell you that the in-dining restaurants will open, and they'll open today. As you go into a restaurant and as you leave the restaurant, I would be hopeful that you would be wearing a mask. Of course, naturally, you can't wear the mask while you're eating. I got that and everything, but absolutely, the mask may very well be the key to everything. And the level of inconvenience from the mask is minuscule compared to the benefit. And so I would urge you in every way to do that, and it may very well be that we have to make it mandatory. We'll make that decision when the National Guard and all of our health experts report back into me again. But we got a problem there, and we know we've expected this from the choppy seas that we know are going to be out there, and we're doing exactly what I said we'd do. We're running to the fire. We're absolutely going to take care of this to the very best of our ability, but we can't just step back and let it go. Because if we just sit back and do nothing and let it go, it's going to brew into something that's not going to be good. Now, as far as additional reopenings, I promised you that I'd give you on the bowling alleys, the movie theaters, and the pools today. As of May 30th, now there's new CDC guidance that has just been released and just came out in regard to pools, and really and truly it was good. And so on May the 30th, we're going to open our swimming pools. On May the 30th, we're also going to open our bowling alleys, our pool halls, roller rinks, and other places of indoor amusement. Absolutely, we're going to wait until June the 5th on our movie theaters, because the simple fact is if you're in a movie and you're there 2 hours and you're sitting there and people are coughing or sneezing or talking or whatever it may be, you're sitting in a stationary spot and everything, and it seems to our health experts that we need to wait another week on that, and I'm going to follow that guidance and everything. But pools on May 30th, bowling alleys on May 30th, and the movie theaters on June the 5th. I want to I want to again encourage in every way, from the standpoint of the cities and the counties, to continue to apply. They just slipped me a note here. Let me read this real quick. Okay, the counties so far that are applying, we only really have one application that's come in right now. We have a few dollars that are absolutely, that are gimmies, and meaning that, there's a few dollars of the application. It's not in question whatsoever. What we're going to do is we're going to be in contact with Kanawha County today, and the dollars that are not, that we don't have any problem with whatsoever as far as processing, we're going to process those dollars with the great work of our auditor and his department. And let me just pause and just say this. J.B. McCuskey and the job that they're doing is oftentimes, it's almost unheralded. But they do, and they continue to do phenomenal work. And I just can't thank them enough. I appreciate the friendship, and I just wanted to say that because I had the opportunity to meet yesterday, and we met for a little while and everything, and talking about different stuff. And I could see so easily that oftentimes as we thank so many different people, these people are behind the scenes, churning and doing stuff every day in every way to try to help us. So I really want us to acknowledge and appreciate them as well. But nevertheless, we're going to pump out a few dollars that are easy dollars, on an app to Kanawha County, and do it right now. And I urge everyone to understand the rules. The rules are real simple and everything. The rules are pretty dadgum restrictive at this time. That's just all there is to it. And as the rules ease up and everything, there'll be more and more and more opportunity, more dollars to be able to flow. But as we go forward, as we understand more and more and more the guidelines, you as a county or a city can continue to apply. And so don't feel like you need to put everything on this one app right off the get-go. You don't have to. You can continue to apply, and as the rules change and everything, it'll make it a whole lot simpler and a whole lot easier on everybody. I do think the rules are going to change, because the guidelines on the state are the same as the guidelines of the counties and the cities and everything that we're working with, as far as I've been told and I understand right now. And so as we move forward and everything, I think that the guidelines are going to ease back on the state, and when they do, they're going to be ease back on the counties and the cities. And I hope and pray that there'll be a few more dollars flow to us, and there'll be plenty of dollars to backfill all of our shortcomings as far as our revenue losses. I want to tell you that the free testing program that we've got going on now in the counties of Marion, Monongahela, Kanawha, and Cabell County, we will be testing there on May 22nd and 23rd from 9 a.m. to 4 p.m. at the locations that are on your screen. This is optional testing, and totally free to all and available to all residents in the counties, in these counties, including people that don't have any symptoms whatsoever. So if you want to be tested, please come out and do so. We especially, encourage our minorities to come, because the more data we have, on our minorities, the better off we'll be. From the standpoint of on a national basis, everyone knows that the numbers surely skewed in a negative and in a bad way with our minorities, and especially the African American community. And so the more information that we have, the better. So please come out and be tested, and it won't cost you a dime, and it's not painful, and it'll be really quick. So please come and get tested if you choose to do so. I guess I want to remind you again about the census. That's you hear from me every day. I hope you get tired of hearing from me, and if you get tired, I'd say, so what? You're just going to keep hearing from me, because I want you to be counted. In West Virginia, will absolutely be a tremendous benefit, as you will, if you'll just be counted. Last thing I have on my list today is, other than our charts, I'll go over them real quick with you and all that, but is in reference to our graduations. If you'll think back, when we had to cancel school to the end of the year, I said at that time, please remember, lots of things, but remember one thing. To our county ed people and our county people, health people and everything, let's find a way. Let's find a way for our graduates to be able to walk up on the stage and accept their diploma some way. If it's maybe even just a duplicate of some type, can you just fathom how hard these kids have worked, how much and how meaningful this is to their families? And absolutely, I want to be able to do that so badly. And so yesterday, when my general counsel was doing such a wonderful job explaining the 25 gathering rules, and in all that, now we've had a continuation of calls to our Department of Ed in regard to graduation. What I'm trying to do right now is work with our Department of Ed, and what it's going to come back to is just this. Our Department of Ed is going to be reaching out to the superintendents and the counties and whatever and saying, can you guys figure a way? Can you figure a way with your health officials and everything else to be able to have some form of graduation where these kids and their families are able to come, maybe wearing masks, maybe spread out all over the place and doing all the social distancing and everything else, but they'll be able to see these kids. And these kids deserve it in every way. And so our Department of Ed right now is pouring it on and trying to figure out what they can do and everything. And it may very well be something that is delayed even until after the middle of July. But they're working, and I'm behind it wholeheartedly, and I hope and pray we're going to be able to come up with something in regard to that. The last thing is these charts, and if we could go to them real quick, and I could just tell you that, and this is led by Berkeley and Jefferson County, but if you'll see the West Virginia positive growth rate, and look real closely just at this right here. We have had days when we were at less than 0.5%. Yesterday we jumped to 3.1%. It's driven an awful lot by the counties that I've referred to in Jefferson and Berkeley because of their exposure so much to the giant population right across their border. So we got to watch them, and I'm sending a guard, and our health officials are on high alert, and we're absolutely all over this. And all I would say to you is, if you're there, wear your mask. Wear your mask. If you go out into a building, wear your mask. And absolutely, we're going to try to work with you in every way. We don't want to slow stuff down there. My gosh, that's the last thing on earth we want to do. But we got to protect you, and we're trying to look out in every way. Our total cumulative positive number hadn't changed much at all. The number of active cases versus recovered is still about the same. All that's fine. The total number of the percentage of our tests, the total number of tests that we've done in West Virginia compared to surrounding states or compared to onto the national average, we're just flying by everybody. So all that's really, really good. Again, we have a situation in the Eastern Panhandle, and we're on high alert, and the guard is on the way, and you'll hear from General Hoyer on that, and you'll hear from Dr. Clay Marsh on that in a few minutes, and I guess that's all I've got right now. Thank you.
All right, thank you, Governor. Now let's first go to Major General Hoyer with the West Virginia National Guard. Good afternoon. Today we continue to support the Division of Corrections with testing support for the staff at Huttonsville, and also are preparing to support the Bureau of Public Health and the local health departments for the test lanes that the governor announced. In addition, as the governor pointed out, he's asked for additional National Guard support to be available to Dr. Marsh and Dr. Schlemp and the Bureau of Public Health as they work with their local health directors in the Eastern Panhandle counties to ensure that we can address the challenges that may come forward. In addition to that, we'll prepare for additional support to the sectors in the Panhandle with best practices, as well as sanitization training as the public health officials deem necessary for support to address the challenges, or as Dr. Marsh points out, the dance that we're doing related to this event. So we will report back tomorrow with additional items that we've been asked to support, that will be asked of us to support for the public health folks and Dr. Marsh and Dr. Schlemp as they lead the effort to address the challenges. Thank you.
Thank you, General. Now we'll go to Dr. Clay Marsh, our coronavirus czar.
Good afternoon. I want to comment on what the governor and General Hoyer have introduced. As we've talked about, this new phase of our coming back out, reopening, the comeback is really one where we are learning to live in harmony and concert with the COVID virus. So as we start to see this coming back out, we will anticipate to identify areas in our state where we see more activity. And in fact, we are intentionally trying to interrogate these areas, these populations, as we look at, as we've talked about, what we've done in the nursing homes with these congregate populations, people living together. The general mentioned the corrections facilities that we have seen some positive cases, where we look for vulnerable populations. We've talked about the African American population, elderly population, among others. And then where we see more activity and where we anticipate the areas of our state that have the highest vulnerability. And the Eastern Panhandle, because of their location, as the governor said, would be a place that has the highest risk of developing more problems, since the area around Northern Virginia, Maryland, and Washington, D.C. are among the highest increasing areas on a proportional basis that we see in the country. So we know that this is an area of high vulnerability, and we've done testing in this area, which is partially accounting for the new cases. But as the governor said, we see an increase in the rate of new positivity, and this is something that we are always looking for. So remember, in this part of the new opening, this is what we have called the dance. And the dance means that we are watching carefully, that we're continuously trying to move forward, as the governor said. But at some points, we may have to slow down or stop or even back up some. And so what we see going on in the Eastern Panhandle now in Jefferson and Berkeley counties are really not surprising. This is not an emergency in that way, but it's really the first steps that we need to learn of this new dance. And the governor said something that I think is really tremendously important as we go forward. He talked about the use of masks and face covers. And let me just make one quick point, that when we look at two countries that really didn't stop their economy, didn't stop the normal activities of their citizens, one is Sweden and the other is Japan. And when we look at the impact that those approaches did in Sweden, that didn't wear masks and relied on people just to stay safe distances and tried to protect their elderly, their rate of death is about 38 people per 100,000. Let's compare that with the US. Our rate of death is 28 people per 100,000. And let's look at Japan, that is really a mask-wearing society. And as we've talked about, masks are not just to protect you from other people infected. It's really meant to protect you, if you don't know you're infected, from infecting other people, because we know that the infectivity of COVID happens very much in this sort of the 2.5 day to half day window before people get symptoms, and some people will never get symptoms. The death rate in Japan, again, remember, the death rate in Sweden is 38 per 100,000. The death rate in the United States is 28 per 100,000. The death rate in Japan is 0.61 people per 100,000. They've had 784 deaths, I believe, which means that on a population corrected basis, they have 2% of what we see in the United States as far as death rate, and ours is over 90,000. So I think that the message, the lesson here is, if we wear masks, if we can get that to 80%, then we know that we're going to be able to protect ourselves and each other. And although this is a cultural change for us, it's one that's so important. If there is a simple answer, it's to do all the things that we've learned how to do with social distancing and washing your hands and keeping your hands around from your face, your mouth, your nose, your eyes. But it also is wear masks, wear face coverings, particularly when you're together and particularly when you're inside. I think this is so important because we know that we produce these droplets even from just talking. A choir practice in Washington State of 60 people, somebody was infected and spread it to 56 of those 60 people. So this is very infectious if you have it in a community. And by looking at communities and biopsying them, doing testing, and we'll do more testing of these areas and work closely with our great county health officers and local health departments, certainly Dr. Slimp and the Bureau. But as we do that, we want to identify people in these areas that can spread and then start to suppress that. Because remember, just like we talked about from the first part of this, and I'm almost finished, the first part of this, that whatever we see today has likely been going on for about 2 weeks. And if we don't get a handle on things, then it can take 2 weeks for us to get things back under control. And that surge that we talked about is still what we're worried about. We're trying to slow that compounding effect, that spread person to person quickly. So these are the new norms for us. This is running to the fire, but also not panicking. And we know this is the new way that we will live successfully with the COVID virus. And as each one of you out there do the things that you can do, including wearing masks and face covers, we'll be able to do this successfully and safely, and again, be an example to the rest of our country. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to the West Virginia DHHR with Secretary Bill Crouch and Dr. Kathy Slimp.
Good afternoon, everyone. I want to talk a minute about vaccinations for children. During this difficult time, some residents are experiencing hardships and loss of insurance coverage. We want to remind residents that DHHR's Bureau for Public Health provides free vaccines to eligible children from birth through age 18 through the Vaccines for Children program, VFC program. Uninsured and other VFC eligible children may receive free vaccines at more than 420 participating provider sites. Eligibility requirements for the VFC program must meet one of the below. They must be Medicaid eligible, uninsured, African American or Alaskan Native, underinsured, children with insurance which does not cover vaccines. So if children fall behind on vaccines during this pandemic, we could face a second crisis with an outbreak of vaccine preventable disease. I urge parents and guardians to contact their child's medical provider to stay on schedule with recommended vaccines. To learn more about the VFC program, please call DHHR's Office of Epidemiology and Preventive Services. That hotline number is on the screen as well as the website. So please take note of that. Please be safe and keep your children safe. Thank you.
All right, thank you. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Mark Curtis with Next Star Media.
Good Good afternoon, everyone. Mark Curtis here from 13 News and the Next Star Group. I was hoping Scott Atkins would be here today, but in his stead, maybe General Hoyer can answer my question because the Guard did so much on processing unemployment claims. Can you tell us where we're at on the PUA claims? I know Scott was talking about perhaps 5,000 people who there was some glitch in the system and they did not get their pay from the May 13th and 12th processing dates. What is their status and how many of them are going to see their benefits finally paid out today and tomorrow?
Mark, I don't have that information available. I work with Brian Abraham, and we can try to get you updated information on that through Scott as soon as we can.
All right, thank you, Mark. Let's next go to Charles Young with WV News.
Hi, this is Charles Young with WV News. It seems like we're putting more and more of an emphasis on the wearing of masks and face coverings. I think it was just a couple of weeks ago that Dr. Marsh, the governor, and others said they worried about this issue dividing people. Can we talk a little bit about why we've pivoted on that stance? And if masks do become mandatory, how would we enforce that? Thank you.
Well, if I could lead off by just saying just this, as we go further and further, I've said it many, many times, this is a very fluid situation. It is absolutely something that nobody's got a playbook for. More and more and more publications, and you've heard Dr. Marsh in the last few days, you know, Dr. Marsh, frankly, is bombarding us all with all the publications that are out there that refer to the fact, you know, if we would just wear masks, really and truly, what may very well be is that may be the inconvenience that we've got to some way tolerate and live with to be able to live with this disease until we get a vaccine. If that's all we have to do, it seems like that's not a big ask. But the net of the whole thing, from my standpoint, is just this. 2 weeks ago, I was really of the opinion that we as we continue to try to pull the rope together and not push the rope, but pull the rope together as West Virginians, you know, what we don't want to do is divide us and have a group of us that says, well, I'm not hacking up with this mask, and another group says it's a good thing to do, but we really didn't have the knowledge that we have today of the fact that it's simply a great thing to do. You know, and so we want to still continue to just encourage, but like in a situation like we've got in Berkeley and Jefferson County, if the reporting comes back to me and they say we need to move now and make it mandatory that people wear masks as they go into the retail stores or the malls or whatever it may be, then that's what I'm going to do. You know, but as far as the enforcement of that, you know, I don't really know how we're going to go about handling that and everything. I'm very, very hopeful that West Virginians will do just what West Virginians have already done, and that is they'll just listen to the guidelines. We can do this from the standpoint of honor, and you've heard Dr. Marsh say over and over and over, if 80% of us, well, I mean, we may have some people that are messing up, and you know we got to go to them and say, you know, here's a mask, you know, it's really our guidelines that you have to wear the mask now and everything. And we'll work through it. We'll just work through it. But if 80% of our people do it, you know, the results are phenomenal. That's all there is to it. And we've gotten more and more and more knowledge, and we continue to seek more and more knowledge every day. And so that's your answer.
All right, thank you, Charles. Next, we'll go to Amanda Barron with WSAZ. Amanda, you might be on mute. Try that one more time.
Oh, you think I was new at this. Sorry about that. Amanda Barron from WSAZ. The CDC released some guidelines last night about our potential return to school and what it could look like. There are many, many pages. There are some that are very, very strict. And I just wonder if you guys have taken a look at those, what you can tell parents about those guidelines as you formulate a plan to go back to school in the fall. Thanks.
I think Secretary Crouch and Dr. Schlemp, you guys can can handle that better than I. You know, I've looked at the guidelines. I've not really bared down and gone through every line, so maybe you could help more than I.
Actually, there is a team within the Department of Education that is looking at that planning forward for a return to school. And so those guidelines will be really helpful in terms of continuing that progress of making those plans forward. So yes, those are out. We're excited to see them. It's always good to have more information to feed into that process. And there's an active group underway looking at what that would look like.
All right, thank you, Amanda. Next, we'll go to David Beard with the Dominion Post.
Hi, this is David Beard. I have a different kind of testing question. As an example, there is a nursing home in our county that tests its staff and its residents weekly. And so you're going to have people that are repeatedly testing negative. I wonder if you look at that statewide, are those repeated negatives factored into the daily and cumulative numbers? Because that could just artificially skew everything down. Thanks.
I think, again, Dr. Slimp or Secretary Kraus or Dr. Marsh, y'all jump in.
Sure. Any testing that is done would feed into our numbers. So that would feed into the numbers as well, because it's any testing done through any lab is what we get reported to us.
And maybe if I could just make one other comment, David. So I think that the governor showed today, we're watching carefully, though, the rate of new cases, not just across the whole continuum, but at a county basis as well. So I just want to make sure, because I think some people are concerned, we're just looking at one single cumulative number and that's all we see. But that is absolutely not true at all. And so this part of the new approach with the virus is that we are looking very much precisely at a county level, and we're responding at a county level. So the first part, it was the state. This part is the 55 counties that make up the state. And that is a really important and big difference. And the governor demonstrated that in the chart that he showed you today. So I just want to reassure people that we are looking very, very precisely, as well as we're looking at the state as a whole book.
All right, thanks, David. Next, we'll go to Kenny Bass with WCHS.
Hi, this is a question concerning the National Guard, and the governor can address it, or perhaps General Hoyer. But the question is, we depend on the National Guard so much in West Virginia, so much more than other states, whether it's building houses and bridges for RISE West Virginia, or it's feeding kids, or it's testing lanes, or it's handling the COVID pandemic, or it's, you name it. We wouldn't be making it without them. I don't think that's going out on a limb to say that. So coming up, they've got some deadlines where right now they're under a federal type of assignment, but approaching 90 days, that's going to change to a state assignment. And that's really going to mess with some of the benefits they receive, the insurance that covers the guardsmen while they're on duty. And it would be a big detriment if the DOD goes ahead and takes them off of their federal status after 90 days. So what efforts is the administration in the midst of to try to stop that, to try to support the Guard, and to actually reward these guys and these women for everything that they're doing for the state? Because without them, I don't know where we would be.
Well, General, let me lead off by just saying this. I've already, gone to work in working with the White House and everything, and pushing for the support of these people, just like Kenny Bass was just saying. There's no question whatsoever, especially in this state. But our National Guard all across our country is phenomenal. But our National Guard in West Virginia is miraculous. That's just all there is to it. And so from the standpoint of your governor, from the standpoint of the administration, from the standpoint of everyone here, we need to push Washington in every way to support these men and women that are doing unbelievable work. And I'm going to just do exactly just that. And some way, somehow, if we can't get it done from the federal side, we'll try every way in the world to get it done from the state side. But some way we've got to keep our National Guard moving freely as the way that they already have. And on top of all that, we've got to be able to compensate and reward them for the great work that they're doing. And, you know, to penalize them and run them up right on the 90-day threshold and then say, we're going to cut it off at the 89th day. Are you kidding me? I mean, really? And everything. So I'm not very happy with that, and we're going to push back as hard as we possibly can. But, General, I'll defer to you.
Kenny, just highlight a couple other things. On May the 1st, Governor Justice sent a letter to Mary Ann Tierney, who is the FEMA Region 3 director, that was to be sent forward to Administrator Gaynor as well as the Secretary of Defense to address this very issue. We asked for our extension to be out through August the 15th, and then would have a plan going forward after that for addressing keeping Guard personnel in support of the various agencies throughout the course of the pandemic. In addition to that, the governor and other governors through the Governors Association have been pushing for parity in benefits for the National Guard on a national basis to give us this appropriate status to take care of our guardsmen going forward. And Brian Abraham and I discuss this about every day because we've been directed by the governor to work this issue on his behalf. Also, we have daily engagement with our United States senators who both are engaged in this effort on the national level. So we'll continue to press that. And the governor on a regular basis is pressing us to make sure that we get the appropriate benefits for all of those folks on the front lines of the effort here.
All right, thank you, Kenny. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, everyone. My topic today is the opioid crisis and how stay-at-home and safer at home has affected the delivery of services and treatment, the addicts themselves, and their recovery.
Okay, I think Dr. Crouch, or Secretary Crouch, this is right up your alley. So go to it.
Yes, Governor, thank you. We have some great concerns there. We're actually in the process of looking at preliminary data right now with regard to overdoses and overdose deaths. We are trying to make sure at the community level that folks have the resources they need and that services continue. I've talked a little bit before about, actually quite a bit before, about the difficulty sometimes of keeping things going using telemedicine. That's especially difficult with SUD, with substance use disorder. So we're looking at that. We're concerned about that. In fact, I will tell you, I have some great concerns about that, as well as concerns with regard to domestic violence and our children and abuse and neglect of our children. So it's an unusual time in this country and in West Virginia, and we keep trying to make sure folks have numbers that they can contact and people that they can connect with. Being alone is difficult. Sometimes being alone in your home with family is difficult. Family, your home should be a safe place. So that's a terrific question, and plan on reporting more on that here possibly next week. We're taking a hard look at that data. So thank you.
All right, thanks, Paul. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, health experts. Hi, everyone. I was wondering about the 3% daily figure that you showed earlier. Given that the opening up was prompted by a cumulative 3%, does the daily figure trigger anything in particular, like slowing down, stepping back? Do you need to see a trend, or is it going to be more of a localized focus on Jefferson and Berkeley counties? Thank you.
Brad, I think there's a whole lot of yeses to your answers and everything, or to the questions that you ask. I love the questions; they're great questions. But I did not say that the cumulative was at 3%. The cumulative is at like 1.92. So the cumulative is still great and everything, and that's what we really are watching more than anything. Because to really move the cumulative, we've got to have a real spikes that we can really see. But you notice how we're watching even a potential that could turn into a real spike. But right now, we're watching a minuscule spike that has the potential of turning into something that's not good. Now, with that, if you just follow what I'm trying to say, what I'm saying is to move a cumulative average, to move a weighted average, you really need to have numbers to where you would spike significantly above 3. Well, what that will do is it shows us right that there's a problem right here, right today. Now, this move of 3.1 shows us that we have an issue, not maybe an outbreak or anything that's really bad now, but we got an issue enough that we take off and we send our guard and we send people and we consult with our medical experts and we bear down. We bear down like crazy to suppress. And so that's exactly what we're doing. But if we were to have spikes of 5, 6, 8%, and it would go on, and we would be on it immediately. But that's what it's going to take, for us to have a super critical situation. Now, the bottom line is none of us want a super critical situation. We may not be able to stop it. There's no guarantees, but absolutely I have all the confidences in the world from our medical community, from our guard, from all the people, that are out there on the front lines. We're going to try with all in us that if we have a little blemish of a problem that could muster into or could morph into a bigger problem, then we want to run to the fire, and that's what we're doing.
All right, thank you, Brad. Next, we'll go to Taylor Stuck with the Herald-Dispatch. I think we may have lost Taylor. Let's go Anthony Izaguirre with the AP. Anthony, are you on?
Governor, what exactly are you prepared to do to deal with these inevitable spikes in cases as the reopening plan continues? Does your office have a concrete plan to slow reopenings in a targeted way or something similar like that?
Anthony, we've got more than a concrete plan. You've got everybody in the world watching this. And just like I said just a few minutes ago, that if our guard goes and our guard comes back and says, okay, we've got a potential that is going, we'll know the numbers for today, tomorrow, and if the numbers, pan out that we've got a continuation of a potential problem, we'll move forward with either mandatory mask or we'll move forward with whatever we need to do, and we'll pull the reins back just a little bit, and we'll monitor and we'll watch like crazy, and if we need to pull the reins back significantly, we'll do so. This will be more of a hotspot or a county by county situation than it will be a statewide thing. There's areas that we may very well, this is not in any way going to be an attack from the standpoint of one size fits all. It just won't work that way. There's no way it'll work that way. At the end of the day, the way we're going to have to live with this disease. Now that's really important that you understand. We're trying to live with something. And it will be much different in the Eastern Panhandle than maybe in the central part of the state or the southern part of the state or wherever. And absolutely as we go forward, we're going to have to treat those situations as independent. And so it won't be one size fits all, but you'll see tomorrow we may have to pull the reins back. We may have to go to mandatory mask. We'll do whatever we have to do, and we'll pull on the reins until we turn it, and it starts flowing back our way.
All right, Governor, I'll turn it back to you.
Well, the only thing I try to make notes as we go forward, to be able to summarize, something that maybe somebody didn't make absolutely clear. But all I want to say is just one thing, and I want to say this to all West Virginians, and I want you to really listen to me and really listen well. Every one of us and everything is not infected, but surely all of us are affected by what's going on. You saw the opening of a sporting event maybe this past weekend or whenever it was, that the Darlington race in South Carolina, NASCAR ran that race without any spectators in the stands. You're going to see not long the Preakness race, the horse race, come about with no spectators in the stands. This situation affects all of us. All of us. And we're trying to find ways to live and exist until we get that vaccine. If you'd have watched the news this morning, you would have seen that they're hopeful that vaccine may very well be here in October. Well, we have to bridge ourselves from now to when that vaccine comes. That's all we're trying to do. This disrupts all of our lives. Can you imagine a NASCAR race with no fans? Can you imagine a horse race with no fans? Let me just say just this. In Berkeley and Jefferson County today, we have an issue. We may very well have to wear masks. I encourage all West Virginians to do that at all times because of the data that we've been receiving over and over and over. I encourage all West Virginians, if you go out into a public place, to wear a mask. Continue to live your life. It is an absolute inconvenience. I got it. But the magnitude of the inconvenience for that is nothing. It's nothing. Just absolutely protect yourself and protect others, and know that all of us are affected, not infected, and absolutely want to try to hold back in every way to keep as few from being infected as we possibly can until that vaccine comes. West Virginia, I say over and over and over, there's nobody on earth that could be more proud of you than me. And you've done absolutely great. And absolutely, I want to be right with you when we all run across the finish line together. And so let's just keep doing it and keep doing the right stuff, and we'll stay on top of it on this end, and you stay on top of it from your end. Thank you so much.